implement measures, initiatives that will not only address the challenges that are relevant to the lapsing of the 210, 780, 778 temporary disability grants and the implications that these lapsed grants have for our beneficiaries. But also the department and SASSA must also ensure that they uphold the dignity of the beneficiaries as well. And I do want to say here, Chairperson, that from the very beginning, when I started this work, which was graciously given to me to lead, I did indicate, and I'm on record in saying, I am grateful to what was done by previous ministers, creating the base for us to be able to work on, but in building this house, a house that will be able to make sure that people live in it in dignity. I indicated already from the very beginning that I want the department and SASSA to look at making things easy for our people. Therefore, that means accessibility of the services must come closer to the people. And then the dignity of the people for me has always been at the center. And I must tell you that having been to the places where I've been, and in particular in the Western Cape, when I went to the SASSA offices in the city center as well as Belleville, for me, I was not only just looking at what SASSA systems are doing, I was looking as the individuals in the queues, what they look like. You can see when you see those people that it's beyond the issue of the social grants. It is also about their well-being in general. You can see when you mingle with them that these are people who are screaming at me, we are hungry, we are dead, we travel long distances to be here, which for me speaks to the issues of transport. It also speaks to the issues of what can we do for those people. And then also, the third one from your letter is to ensure that SASSA complies with COVID-19 regulations and its offices and at the pay points. And the reason why we are here in particular is that letter that you wrote to us and the events that had happened both in Belleville, but also that happened in Masipumelele, in Khayelitsha, and other areas that I visited to. So my understanding, Chairperson, is that these three issues are central to the presentation that has to be made by the department and SASSA today, with momentarily to be rendering the portfolio and especially relying on the first-hand oversight encounters at SASSA offices and pay points over the past year. At various sites throughout the city of Cape Town, I have instructed the department and SASSA to focus their presentation on these issues so that we don't have fancy presentations that are there, but they must have a content that responds to that. I've also instructed the department and SASSA to respond to the three dimensions in the letter by specifying the observable challenges that the presentation is addressing itself to, providing the district, metropolitan, municipality level demographic figures and affected populations, explicitly mentioning and quantifying the public and partnership investments with which identified challenges will be undone, specifying the applicable timeframes and projecting the relevant outcomes and impact. Chairperson, the committee has consistently spoken to us about the issue of impact. Nothing less than that. This should be unacceptable to our communities if we do not respond to that. Besides temporary disability grants being primary and often only incomes for the majority of the persons with disabilities and on which their social dignity is founded, livelihood of their households provided for, and medical supplies afforded, both the department and SASSA are well aware of the fact that each approval of a temporary disability grant lapses 6 months from the date of its approval. So while information and data analysis systems should be used towards informing intelligent resource allocation, the department should forthwith and activate the harmonized assessment tool for disability that was